Hello radiographers, hope you are doing good. Welcome to a new tutorial video and it's about a contrast X-ray and its barium mill. A very common contrast X-ray and very interesting topics. So without further ado, let's start. Barium mill is a contrast study of the stomach and the duodenum and sometimes the distal esophagus. So here you can see two images. Here you can see two images. One is filled with contrast. The stomach is filled with contrast and also the small intestine. So it's a diagram of barium meal and follow through. So when it's talk about only the stomach, it's called the barium meal, and when the small intestine is added with the stomach, then it's called the barium meal with follow through. And sometimes barium follow through can be advised separately, and sometimes barium meal with follow through is advised. And the second image is actually a fluoroscopy image, so that it's looking inverted image. So let's move to the next slide, and we have to know the anatomy of the stomach. So this is a diagram of the stomach, and you know that esophagus ends here at the gastroesophageal junction, and the upper part of the stomach is called the fundus, and the mucosal folds inside the stomach is called the rugae, and this is the, of course, the lesser curvature of the stomach, and this is the greater curvature of the stomach, and this part is the body of the stomach, and this is the antrum of the stomach, and it's called the pyloric sphincter, and this is the duodenum of the small intestine. And on the right side there is a image of the barium meal, and here you can see that the stomach is filled with contrast, positive contrast, and above there is a fundus of the stomach, and it's filled with the gas, and so that it looks dark or black, and because of the contrast it looks bright. And here you can also see the anatomy of the stomach, that the body of the stomach and the lesser curvature and the greater curvature, and this part is called the incisura angularis, and after that this is the antrum part of the, or you can see a pyloric antrum, and this is the pylorus, and after the pylorus the small intestine starts, and this is the duodenal bulb. So there's the anatomy. Hope you understand, and you have to obtain a clear concept about the anatomy of the stomach and the duodenum. So let's go to the next slide, and it's about the anatomy of the duodenum, and it's also an important topic. We have to understand the anatomy of the duodenum. So where the stomach ends, the duodenum starts, and the duodenum have the four parts. And the first one is the duodenal cap or duodenal bulb. This is the first part. So this, you can see that this is the first part, that is arrow marked with arrow, and it's number 1, and this is also called the duodenal cap. So when the pylorus ends, the duodenal cap starts. And the second part, this is the second part, and it's called the descending part of the duodenum, and this is the horizontal part of the duodenum, and it's called the third part. And again the ascending part, and this is called the ascending part or fourth part. So this was a concept of the anatomy of the duodenum. And now, what are the indications of the barium meal? So let's know this. So there are two types of symptoms. One is the symptoms related to upper GI tract, and they are dyspepsia. So dyspepsia means that it's a condition of impaired digestion. If the patient has a problem with the digestion and feeling of heartburn or abdominal fullness or nausea or belching, that's the condition of the dyspepsia. And then weight loss, patient is losing his weight and epigastric pain and the anorexia. So anorexia is a condition where patients don't feel hungry and he feels that his stomach is full, and it often refers to simply as an eating disorder characterized by food restriction and body image disturbance, fear of gaining weight, etc. And then anemia. So you know that anemia is a condition where the hemoglobin counts reduce below the normal range, and the heartburn, vomiting, and the another causes are the other symptoms like upper GI tract, gastrointestinal hemorrhage, upper abdominal masses, and gastric or duodenal obstruction, then malignancies, tuberculosis, motility disorders, GI reflex, assessment of perforation, and pre and post surgery assessment. So there are various indications for barium meal X-ray, and there are some indications for children like gastroesophageal reflux of the children, and then pyloric obstruction. So there may be obstruction in the pylorus part of the stomach of a children, and there is also a malrotation. So malrotation is a congenital defect where the intestine are constructed as in a, so malnutrition is a birth defect where the intestine don't form in the correct position within the abdomen during fecal development. And now let's know the contraindications. So first contraindication is suspected cases of gastroduodenal perforation, barium peritonitis. So there may be a gastroduodenal perforation. So in this case, barium meal is contraindicated, and if the patient have the suspicion, aspiration alternative contrast should be used. So aspiration is a condition where the barium sulfate contrast may go to lungs and patient feel aspiration and difficulty in breathing. And large bowel obstruction is a contraindication, and it can happen. Barium inspission may occur for this, and fistula's communication with any organs other than parts of the GIT. So some parts of the gastrointestinal tract may have the fistula with the other organs, and it's a contraindication. And another one is the recent biopsy. And now there is methods of the barium meal study, and the one is single contrast study method, and the second one is double contrast study method, and the third one is biphasic study method. So in single contrast study, only barium sulfate solution is used, and double contrast study, barium sulfate solution as well as the gas producing agent is used for double contrast. That means that barium sulfate works as positive contrast, and gas producing agent produces gas, and they produce negative contrast in the image. And also the biphasic phase study means that both study have been taken, single and double both studied together. So here you can see an image of a single contrast study and double contrast study. So in single contrast study, you can see that only the stomach is filled with only the barium sulfate solution. There is no gas, and this is a fundus gas, and it's a normal gas. And if you see the second image, that there is a double contrast image, and you can see that the stomach is filled with gas and some barium sulfate solution. So this is a double contrast study. So go to the next slide, and it's the contrast media. So what types of contrast media used in the barium sulfate, barium meal study? The first one is the barium sulfate, and for double contrast study, we have to use the high density barium sulfate, and that is 250% weight per volume, and our total solution will be 135 ml. And then low density barium, that is 100% weight per volume for single contrast study. So let's discuss about a weight per volume, what it means. So if I took this 250% weight per volume, so it means that in this concentration, if the water volume is 100 milliliter, and then the barium sulfate will be 250 milligram. So that's the concentration. Sorry, 250 gram. For 250 gram, barium sulfate will be dissolved with 100 ml water. Then it will make a 250% volume solution, and from this solution we will use 135 milliliter barium sulfate solution. So when it comes to 100% weight volume, that means we have to use 100 gram barium sulfate in 100 milliliter water. So that's the thing that is described by weight per volume. And then sometimes water soluble contrast used, and gastrographin is one of them. And it's when the water soluble contrast is used when the perforation or post-operative anastomotic failure suspected, and effervescent is used for double contrast study, and it's a gas producing agent. So effervescent means that it's the materials which produces gas or bubbles, like used for double contrast study, and carbex granules or tablets composed of sodium bicarbonate or citrate, and when swallowed with a small amount of water, the granules or tablets release 300 to 500 ml of carbon dioxide, which distends the stomach. So here is the image of the barium sulfate suspension, that is 98% weight water per weight or weight per volume, and the neat content is 340 gram. And the another one is gastrographin, and this is a water soluble contrast. So there are some pharmacological agents used like buscopan and gastrographin to increase the function of the stomach. Sorry, these are used to delay the gastric emptying. That means it decrease the function of the stomach, and it decrease the peristalsis movement of the stomach. And now the patient preparation. The first preparation is patient should be fasting for 6 hours, and or patient may have fasting throughout his night and avoid smoking. And you can ask the patient some question about have symptoms about previous gastric surgery, and having the uh, fasting over the night, and about the also the possibility of pregnancy. And now explain the procedure to the patient, because their patient should be hold his breath for spot filming, and you have to train the patient for this, and caution the patient to belch after ingesting carbex granules or drinking the bubbly barium. That means when the patients drink the effervescent some substance like carbex granules, and it will produce gas, so patient will not burp or belch, and it will release the gas out of the stomach. So he or she will hold his burp. So let's start the double contrast study technique. So this technique was first introduced in the Japan for high incidence of gastric malignancy, and the screening in a mass screening start for the gastric tumors and for early detection. And this technique is much relies on fluoroscopy, but more on filming, which is done overcoat for better image quality. And double contrast technique is very useful for the mucosal lesions like polyps, mucosal erosions, and ulcers, and recurrent tumors and post-operative studies. So there is preparation for double contrast study. So double contrast study should not be done if secretions exist in the stomach. So stomach should be dry and empty of fluid, and the secretion will prevent adequate mucosal coating and may mimic tumors. So a dry stomach is necessary for the double contrast study, and a dry fluid-free stomach is essential. So this was the first line, but appears at last. So sometimes it happens. And the contrast media for double contrast study is a high density contrast, and example of EZHD 250% weight volume, and total is 135 milliliter solution, and carbon granules of course for producing gas. So first is the technique. Let's start the technique. So at first take a contour film of the abdomen in AP view, and it's in supine position, and a gas producing agent is swallowed, and then the patient then drinks the barium while lying on the left side supported by the elbow. So in the meantime, you make the barium solution, barium sulfate solution, and it looks like a milk, and you put it on a glass and give it to the patient and tell him to drink this whole glass of barium solution. And patient should be on the left side, so that the contrast go to the left side, and barium cannot reach to the duodenum quickly, and it will obscure the greater curve of the stomach. And then the patient lies supine. Ask the patient to lie supine and slightly on the right side. So to bring the barium up against the gastroesophageal junction. So now the patient is in supine position and but in slightly right side, so the barium can reach the gastroesophageal junction. And this maneuver is screened to check for reflux. So any gastroesophageal reflux will be checked in this position. And now give IV injection to smooth muscle relaxant like buscopan and glucagon. So it will decrease the function of the stomach and decrease the peristalsis movement. And ask the patient to roll onto the right side and then quickly over in a complete circle. So to finish in a right anterior oblique position. So ask the patient to roll over and end in a right anterior oblique position, and this will help to coat the gastric mucosa, and good coating has been achieved in the area gastric in the antrum are visible. So it will be clear when you see the diagram. So this is the positioning diagram. So in this diagram, the first of the option is A, and in this option you have to roll the patient. So from right to left, you have to roll the patient and finish in a right anterior oblique position. So this is the finished position, and after rolling, and in this position, now go to B and take this spot films. One is right anterior oblique position, and in this position the antrum and greater curvature will be visible. So you can see that this is the stomach, and the black circle is the barium. So barium in this position, barium goes here at the antrum and greater curvature. And now ask the patient to be in supine position, and in this position antrum and body of the stomach will be visible. And now ask the patient to rotate in the left anterior oblique position, and in left anterior oblique position laser curvature will be, and the pylorus will be visible. And now ask the patient to left lateral position, and this position will give you the image of the fundus. So here you can see that in this position the barium will go down, and in upper the fundus will visible with the gas. And now go to C, and in this position turn back from the lateral. So from the lateral position, tell the patient to turn back. That means this is upside down position, and in the right side there will be a compression pad given. So this is a prone position. So in prone position, take the image and it will show you the duodenal loop. So this is the duodenal loop, you can see. And if you want to take the duodenal cap, then you can take it in prone position and right anterior oblique supine and left anterior oblique. So take 4 spot film of duodenal cap in this position. And now take the images in erect position. So first take a image erect position in anterior posterior view, AP view, and it will give you an image like this, and it will show the body of the stomach and also the fundus. And now take images of right anterior oblique and left anterior oblique position in erect position, and then a cap, duodenal cap will be visible here. And then if at the last you can take extra images for in right anterior oblique position to see the esophagus or gastroesophageal junction, and in this situation tell the patient to drink another cup of barium swallow, another cup of barium sulfate, and you have to visualize the esophagus or esophageal junction. So, the films are spot films of the stomach at the right anterior oblique, supine, and left anterior oblique, and left lateral, that is tilted and head up 45 degrees. That means the table will be tilted and the table in the head side will be up in 45 degrees so that the fundus is visible. And the next one is the spot film of the duodenal loop, and for this you have to take prone position and also right anterior oblique position. Of course, if in both the situation the patient is lying. And also you can take the duodenal cap in lying position, and for this you have to take prone, right anterior oblique and left anterior oblique, and also supine position. So as the barium reaches the duodenal cap, your barium meal study has finished. That means the barium is entering the small intestine. And additional views of the fundus in an erect position may be taken at this stage if there is suspicion of a fundal lesion. So I'm coming to images, so don't worry about this theoretical presentation. When you see the images, and you will feel better. So spot films of the esophagus are taken while barium is being swallowed to complete the examination. So at last you can take some spot film of the esophagus that will show the gastroesophageal junction or any reflux. So this is the right anterior oblique position. You can see that the patient's in right anterior oblique position, and in this position the pyloric canal and duodenal valve will be visible. So you can see that the right anterior oblique position is showing the double contrast oblique stomach and duodenum, and not esophagus entering stomach. So here is the esophagus entering the stomach, and you can see the fundus and body of the stomach, and this is the antrum, and already barium sulfate goes to the small intestine. Fundus, greater curvature, duodenal valve. So this is the duodenal valve. This is the pylorus. This is the left posterior oblique or LPO, and this is the image of left posterior oblique. You can see that the double contrast study. The gas is in the stomach and also the barium sulfate obscuring the fundus, and the body is filled with the gas and the pylorus. And this is the lateral position, and in this position the stomach duodenal valve and duodenal loop is visible. So here is the position, lateral position, and you can see that the duodenal valve and the duodenal loop is visible. This is the duodenal loop. This is the duodenal cap or valve. This is the second part of the duodenum. The third part and fourth part. So a very good example of the double contrast barium in a barium meal. This is the left anterior oblique position to demonstrate the laser curvature of the stomach. And in this position, you can see that the laser curvature is visible here, the left anterior oblique position. And this is a PA position. Sometimes PA position is very useful because the stomach is distended, and you can show the image. You can see the image of the PA position. And this is a single contrast study. Only the barium sulfate is used, and entire stomach is visible here and this is a anterior posterior view. Sorry, this is a barium PA stomach or PA view, posterior anterior view, single contrast study, and body and pylorus filled with contrast agent. And this is a single contrast study of the barium meal, and the stomach is filled with barium sulfate contrast and also the pylorus. And this is the duodenal valve or duodenal cap. So you have to show the duodenal cap in the barium meal study. This is the example of Rugi folds. That means the stomach has mucosal folds, and it's called the Rugi. And in this image, it's shown very good. And the upper part of the stomach, including fundus, is filled with barium sulfate, and there is the negative contrast. And this is another example of double contrast study in supine position. So you can see that the fundus is filled with barium sulfate, and maybe it's taken with a tilted position, and this is a angular notch, and you can see that the stomach is filled with gas. So it means that this is a double contrast study, and this is the antrum part of the stomach, and this is the body. The first image is a single contrast study, and it's a PA stomach of the duodenum, PA view of the stomach and duodenum. And the second one is the double contrast study. You can see the gas is the stomach and also the barium sulfate passes the stomach and goes to the small intestine. And this is a beautiful example of double contrast barium meal. And in here you can see the normal reticular pattern of the mucosa. You can see the normal pattern of the mucosa in the wall of the stomach. So here is another image with the anatomy level. So here you can see that this is a single contrast, that only the barium sulfate is filled with stomach, no gas here. So pyloric, this is pyloric antrum, this is the pyloric canal, and this is the duodenal cap, and passing the duodenal cap, barium sulfate contrast goes to the small intestine. So barium broken up by circular folds of duodenum. So you know there are circular folds in the duodenum. So as the contrast reaches the passing the duodenal cap and reaches the small intestine. So here the barium meal study ends. And fourth part of the duodenum. This is the fourth part of the duodenum. Let's go to the next slide. And this is a beautiful image of the barium mill. And this is one of my favorite images that I found. And you can see that the fundus is filled with gas, and this is the body part filled with the barium sulfate solution, and this is the lesser curvature and this is the greater curvature, and this is called the incisura angularis. This part is the incisura angularis, and this part is the antrum of the stomach, and this is the bulb, duodenal bulb or cap. This is the pylorus. So this is the pyloric end of the stomach, and contrast starts to enter into the small intestine and already reached the duodenal bulb. So that's the end, and you have to after care patient. There are some problems during after the procedure. The first one is that the patient may have stools in white colors, white stools. So you have to assure the patient that it will overcome after a few days. And the patient should be advised to eat and drink normally to avoid barium infection, and laxative may be given. And number 3 is that the patient must not be leave the department until any blurring of vision produced by the buscopan has resolved. So we give buscopan injection to reduce the peristalsis function or peristalsis movement, and because of buscopan, some patients may feel blurred vision. So you have to wait for this that patient is okay. And the complication is that barium can be leaked through the any unsuspected perforation and aspiration of stomach contents due to the buscopan, and conversion of a partial large bowel obstruction into a complete obstruction by the impaction of barium. So if the patient have a partial bowel obstruction, but after barium sulfate, drinking barium sulfate, it may cause a complete obstruction. So this is a complication. And another one is a appendicitis, and it's called a barium appendicitis. So if barium impacts in the appendix, so sometimes barium impacts in the appendix and stored in the appendix, so and it may cause appendicitis. So this is a complication. And another one is side effects of the pharmacological agents. So pharmacological agents we use is buscopan and glucagon, and for this patient may have some side effects like blood vision or dizziness. So this could be in mind. So thanks for watching. It was a long tutorial video, but I have to make this all to make you understand. So if you like this video, please hit the like button, give me a thumbs up, and don't forget to subscribe my YouTube channel, and see you in the next video tutorial. Thank you.